So I want to welcome everybody to our Dairy Goat webinar program. This is hosted by the Iowa State University Extension and Outreach Dairy team, and also supported by our USDA grant that's focusing on dairy education and research. So this grant is focused on dairy education and research, and so we've been starting to do quite a bit of webinars on dairy goats, and this is our third in our webinar series here this year. My name is Jennifer Bentley. I work with ISU Extension and Outreach as a dairy field specialist housed in Northeast Iowa. I have a colleague on here today, Dr. Larry Tranel. He is also a dairy field specialist housed in Northeast and Southeast Iowa. So he's going to be helping me on the webinar during this as well. And then we also have some team members that are going to be presenting here on the webinar. And so during this webinar, we're first going to kick it off with Natalie Urie. She's a veterinarian epidemiologist with the United States Department of Agriculture's Animal and Plant Health Inspection Service, Veterinary of National Animal Health Monitoring Systems. And she's going to review the 2019 NAHMS dairy goat study, and it's really going to be focused on highlighting the kidding and disbudding management on U.S. dairy goat operations. And then we'll follow that up with our ISU Extension dairy veterinarians here. Over the last several years, the Iowa State University Dairy Goat Welfare Team has performed a series of kid disbudding projects to help evaluate alternate approaches to traditional heat disbudding and pain mitigation approaches. Paul Plummer and Jan Shearer are both professors with Iowa State University College of Veterinary Medicine and Iowa State University Extension and Outreach. And so they're going to provide an overview of those research outcomes and really frame it up in practical approaches that producers can consider for implementing in their disbudding and pain mitigation program. So before we go ahead and let Natalie share her screen here, I do want to just note some housekeeping things here. If you could leave your microphones muted during the presentations, that would be helpful during the delivery of the information. If you have questions during the presentations, go ahead and type those into the chat box, and we'll address those first at the end of Natalie's presentation. She will have to log off after her presentation, so if you have any questions directly to her, if you wouldn't mind putting those in right away. Otherwise, she will provide her email and we can follow up with her at the end of the webinar. We will record this and it will be archived on our Extension Dairy Team Goats web page for further viewing. I also will email it out to all the registrants here today in case you want to go back and review that as well. And then at the end of the webinar here, we are going to do an evaluation. So I'll put that link into the chat box. So if you wouldn't mind just clicking on that before you log off here today and fill that out, that'll really help us with our dairy goat educational programs here as we go forward. So with that, Natalie, I'm going to go ahead and stop sharing my screen, and then you're going to be able to share yours. So thanks, Natalie, for being on and being able to present that USDA or the dairy goat NAHMS study. Thank you.
Thank you, Jennifer. And can everyone see that okay?
Yes, we can.
Yep.
Awesome. So as Jennifer said, my name is Dr. Natalie Urie, and I'm a veterinary epidemiologist with the National Animal Health Monitoring System, which is part of the USDA APHIS, so Animal and Plant Health Inspection Service. So what I'm going to chat about today is I'm going to start by just giving a brief study overview, how these studies work and why we do them within NAHMS, and then I will go on to discuss the results from the NAHMS Goat 2019 study, specifically focusing on kidding management, and then spending most of the time talking about the disbudding practices that we collected information on as part of the study. So with that, I just wanted to take a few minutes and familiarize you guys with NAHMS. Just from looking on the names here on this list, I know quite a few of you have been involved with NAHMS studies. The previous goat study was done in 2009. So we were very excited when we got to repeat the study in 2019 and provide biologic collection as well as part of the study. So those of you who are not familiar with NAHMS, NAHMS conducts national studies that provide essential information on livestock and poultry health and management to decision makers. This includes producers, researchers, and policymakers. We generate national estimates from these studies that can be used to provide up-to-date and trend information needed to monitor animal health, support trade decisions, assess research, and help to figure out product development needs. It also helps answer questions for consumers and potentially set policy. So overall, the NAHMS purpose is to do these national studies that provide detailed information on health and production on U.S. livestock operations. So how do these studies work? They are large studies that are designed in collaboration with industry. So on the goat study, we collaborated with the American Goat Federation and the American Dairy Goat Association as well to make sure that we were meeting the needs of the industry. These studies are voluntary. So if you are a producer that participated in this study, thank you very much. We really appreciate it. And we could not collect this information without you. Without the producers, we cannot do this. And then our results are statistically based for population estimation. So this allows us to say, these are the general practices that we're seeing in the goat industry across the United States. Additionally, these studies are all done in strict confidentiality. So in order to obtain high quality data, producer participation must be voluntary, and the data from individual operations must be kept confidential. So we do these studies in cooperation with the National Agricultural Statistics Service, and this helps us make sure that we get a representative population of producers. So how the studies work, we start with a needs assessment. This was done back in 2017, where we sent an assessment out to the industry and producers, anyone who is involved in the goat industry. And then that helped guide our study design and our questionnaire development in collaboration with researchers and industry and knowing what exactly we could collect. We then designed the study, and that often includes a biologics component. We started data collection in September of 2019 for the second phase, and that went on until March of 2020, which we stopped collecting a little early because of the pandemic, but we still had a great response. We're currently working on the data analysis and reporting phases of the study. So once we get all of the questionnaire data and biologic data, we work with collaborators to analyze that and then put together reports and get the information out in various ways, including webinars like this. So here are the states that participated in the NAHMS Goat 2019 study. These states represented 83% of US goats on farms with 5 or more goats, and 78% of US goat farms with 5 goats. The reason we did those 5 or more goats was to limit some of those operations that had likely gone out of business or had goats as pets and didn't necessarily have the capability or need to answer these management practices that were discussed in the questionnaires. And you can see we divided into East and West regions. We divided on Texas and Oklahoma on the north-south I-35, just because of the different weather and management practices that occur there. So quickly, our study objectives, we wanted to describe changes in animal health, nutrition, and management between 2009 and 2019. Describe practices to control internal parasites and reduce anthelmintic resistance, which we recognize is a problem for a lot of goat producers. And then describe antimicrobial stewardship and antimicrobial resistance prevalence. Describe management practices associated with economically important diseases, one of those being scrapie, and then provide a serologic and DNA bank for future research. We also collected biologic samples. So here's just a brief overview of all the samples that we collected. We did fecal samples, and those were sent for fecal egg count reduction tests and then enteric microbe testing as well. We collected blood samples and we looked at scrapie resistance on the genotypes in the alleles K22 and S146. And then we collected serum and DNA that was stored for future research. Lastly, we collected nasal swabs and vaginal swabs to look for a mycoplasma pneumonia with the nasal swabs and Coxiella burnetii testing for the vaginal swabs. So as I was saying, in the study process, we're currently at the data analysis and reporting phase. As far as the response rates of the study went, we were pretty pleased with the response we got from the goat industry. So 60% of eligible operations completed phase 1, which is the general goat management questionnaire. So we had data from 1,840 operations across the United States. And then 60.5% of those operations that completed phase 1 went on to complete phase 2, which included the veterinary services questionnaire, which is more veterinary focused, and then also the biologic collection, which included all of those listed above. So with that broad study overview, I'm going to spend the next 10 minutes or so discussing the study results. So regardless of operation size or region, the primary use for goats was meat. 63.5% of all operations that participated in the study had at least one goat to produce meat. Milk production was a primary use for at least one goat on 26.1% of operations, and only 2.7% of all operations kept a goat with a primary use as Angora fiber. Goats as pets and companions were kept on 11.6% of operations, and a higher percentage of small and medium operations reported any goats with a primary use as pets or companions compared to large operations, which is what we would expect. Operator experience. So about 1/2 of all producers on all operations expected to have about the same number of goats in 5 years compared to their July 1, 2019 inventory. So that was great to see that they expected to have the same number or that they were hoping to grow. There were no differences in expectation in regards to herd size or region. And only 4.7% of producers on all operations expected to have no goats in 5 years. And then we can see here that as operation size increased, we saw that producer experience increased as well. So of all operations that bred any goats, which was 86.3% of the operations, about 3/5 had a defined breeding season. And we define that as bucks kept with a group of does for less than or equal to 4 months. A higher percentage of large operations had a defined breeding season than small operations, and there were no differences by region in the percentage of operations that had a defined breeding season. And then for operations that did have a defined breeding season, 88.6% bred their does once a year, and 7.1% bred the majority of their does more frequently than once a year. Okay, here we talk about placenta and afterbirths. So as you guys know, the placenta from goats can attract predators and can potentially spread disease to other goats if it contains an infectious agent, such as Coxiella burnetii, which causes Q fever. For operations that had any kids born, slightly less than 1/2 of all operations left the placenta in the field birthing area and did not remove it. A higher percentage of large operations left it in the field or birthing area compared to small and medium operations. And a higher percentage of small and medium operations disposed of the placenta in the dump or the landfill compared to large operations. And here you can see all of the practices by percentage. So with that, I'm going to jump into the disbudding management, which was the section of our questionnaire. So for the 85.7% of operations that had kids born during the study timeframe, a higher percentage of dairy operations disbudded or planned to disbud kids compared to meat and other operations, which we can see here. And then a lower percentage of kids on meat operations had or were expected to be disbudded compared to kids on dairy operations. So what we see is more dairy operations are disbudding kids and more kids on those operations are being disbudded. Then if we look at it by region, herd size did not impact the percentage of operations that had or were expected to disbud kids or the percentage of kids that were going to be disbudded. But a higher percentage of kids in the East region had been or were expected to be disbudded compared to kids in the West region. And then we see slightly more operations in the East region disbudded kids than in the West region as well. So operations disbudded kids at an average of 16.3 days. Disbudding kids after the age of 14 days is technically classified as dehorning, not disbudding. Goat kids should be disbudded in general between 4 and 14 days of age. So disbudding during the age range will ensure that goats truly are being disbudded and not dehorned. There were no regional or herd size differences regarding the age of disbudding, but there were operation differences across primary production type. So meat operations disbudded kids later than dairy or other goat operations. We can see here that meat operations disbudded kids around 20.2 days of age, whereas dairy and other were 14.6 and 13.9 days on average. So the disbudding methods that are used, the majority of operations used an electric dehorner or debudder or hot iron. This method was on 93.3% of meat operations, 95.8% of dairy operations, and 99% of other operations. And then we see less common methods such as the caustic paste, rubber band, or shears. Caustic paste was on 3.2% of meat operations, 1.2% of dairy, and 1% of other operations. And then other disbudding methods that were listed included rubber bands, shears, and then unknown disbudding method by a veterinarian. So 30.4% of operations used analgesics or anesthetics during the disbudding of their kids. There were no differences across herd size, region, or primary production type regarding the use of analgesics or anesthetics when routinely disbudding. Then the personnel that completed the disbudding, so 85.7% of operations that had kids born, a higher percentage of those dairy operations disbudded or planned to disbud. And then if we look at this, we see that the majority of disbudding is done by owners on that operation, with 16.5% being done by a veterinarian. And then we see that on small and medium operations, veterinarians perform the disbudding more often than on those large operations, with only 1.7% of large operations disbudding the kids. So with that, we do have additional information available on our website regarding the study results. There are these infographics, and there is a disbudding info brief as well. All of these materials are available in English and Spanish. I can paste this link in the chat as well as my email. So if you would like any copies to share at meetings, or if you're an extension and would like more information regarding the study to share, whether it's for PowerPoints or whatever you may be doing, we're here and we're happy to help. We want to get this information out to you guys and make sure that it is being used to support the industry. So our next steps, we're publishing the first large report that will be available on the website, hopefully here by the end of summer. We're continuing to finalize our data and publish those biologic results. We're also writing a lot of infographics and info briefs. There will be a couple more available soon on the scrapie genotyping results and the agritourism results. But as I said, right now, the disbudding info brief is up there in both English and Spanish. So if you're interested in that, feel free to use it. With that, I'd like to acknowledge all the folks that were involved in the study. And I cannot forget all of our producers out there who anonymously participated. We could not do this work without you. And thank you again to all the university and folks who collaborated with us and then reviewed questionnaires and have guided us along throughout the study. So with that, thank you, and I will take any questions.
Question here, do you know how likely producers are to use analgesics when they do the disbudding?
Yes, let me pull that number back up. So let's see here. It was 30.4% of the operations that used it. Are they wanting to know that percentage of producers versus veterinarians? Because in that case, I don't know, but we do know that not a ton of operations, so 16.5% of operations had veterinarians do the disbudding. So I would say, I don't know what the split is. That's something we could definitely look at, is the percentage of producers versus veterinarians that are using analgesics or anesthetics.
Yep, and I think you answered that question. It looks like it was a question versus producers versus veterinarians there. So
there's also a question about which analgesic.
Yep.
Wow.
And we did not collect any information on which specific analgesics or anesthetics were being used.
All right, Larry, did I miss any other questions here?
Well, just said there's Bailey put in a best practices title, implied to me that there is to be some outcome data. So we listed the best practices, which apparently are the popular practices. But is there any outcome data coming out from those practices?
As far as what specific outcomes?
Correct.
Yeah, Larry, I think some of that's probably coming from the title of the second section that me and Jan are getting ready to do, and,
Okay.
and not the NAHMS study. So that's coming.
Yes, sorry about that. So as the NAHMS studies, we tend to just say, here is what is currently occurring within the industry. And then we put a little more regarding best management practices in those info briefs. But because these are really generalized for across the United States, we leave it up to the producers working with their veterinarians, extension, and other folks to really help implement what the best practices on their operations would be.
Yep, and then it looks like there's another question here. Do you have any preliminary results regarding the occurrence of C. burenti?
We are just working on those results. So the testing was done with CDC, and because of COVID, it was slightly delayed as far as getting that data analyzed. So we're working on that right now. Hopefully within the next couple months, we'll have results regarding the prevalence of C. burnetii.
Appreciate you being on our webinar here today. If you wouldn't mind, before you log off, to put your email in the chat box if people have any further questions for you. And I know you were going to also put the resource link to all the information that you shared here today, as well as, you know, some of the follow-up information that you're going to be having come out here in the next couple of months as well. So we really appreciate it.
No problem. Thank you so much for having me today.
So with that, I think that's a good lead into Dr. Plummer and Dr. Shearer's presentation on best management practices of disbudding. So Dr. Plummer, I'll let you go ahead and share your screen here and we'll get right into that part of the research.
All right. Are you seeing the presenter mode or the?
I'm seeing your slideshow with your notes on the side. There.
That work better?
Yep.
All righty. Well, thank you everybody for attending the webinar today. I'm going to present a little bit of data that at the end I'll go through some credits, because much of this work has been done by, well, all of the work that we'll present has been done by a great team of folks that we have here based at Iowa State, working in this area of dairy goat well-being and welfare. And I think almost all of the research that we're going to focus on today is funded by USDA NIFA, related to optimizing and benchmarking dairy goat well-being. That was also part of a project where we did look at benchmarking across 30 Midwest goat dairies in a variety of well-being areas, and we're not going to cover that data. Some of that's already published, and that project continues, and so we'll have additional information coming forward on that as well. So maybe if folks are interested in the future, we could come back and visit on that particular topic. So with that in mind, we wanted to give you some update on some of the disbudding work that we've been doing. And so we're going to keep this fairly high level. Happy to answer any questions that might come in. But we're, because we're kind of hitting a broad swath, I see many of you on here are veterinarians. So some of this, obviously a little bit more science-based stuff, you know, you may have to ask us because we can't present that here. But also a lot of producers on here. We're hoping that we present this in a manner that is useful to you with some, you know, best practices and what the data really shows. So to start with, you know, what will we cover here, kind of the agenda. The first part, we'll talk about why would we be concerned about disbudding. Some of that answer is intuitive, although we know from our benchmarking studies that it's not all intuitive. And then we'll talk about, is there a better alternative to cautery disbudding? So what are options could we potentially consider? We'll talk about how long can cautery disbudding iron be on the head? And that's an area that I think we've had questions for a long time, and we're starting to get some data, albeit very expensive data to get. And so we'll present that. We'll talk about how we can address some pain, and then in all of this, you know, what do we currently suggest? The other caveat that I'll put forward is this study was really based on looking at commercial scale application of these approaches. So here in the Midwest, you know, farms involved in our study range from anywhere on the lower end, you know, a couple hundred does up to several operations that are 6,000 does plus. So the USDA grant was really focused on how can we address these issues on scale large commercial operations where they're probably being performed by non-veterinarians. You saw in the data that Natalie presented that on our large operations, less than 1% of disbudding is done by veterinarians. So for the veterinarians on the call, this isn't necessarily, what we might use for pet goats or the one individual, two individual animals. But when we're looking at disbudding, 50 to 100 kids a day, how can we do that at scale and as best we can? So with that as a caveat, or want to think about or rethink, level set here on this issue of disbudding. So why would we disbud? I think most of the folks on the call recognize that it reduces injuries. It also reduces our space requirements. Animals with horns, we have higher recommendations for floor space, bunk space, all of those. So it allows us to be a little bit more efficient in our space, space usage. And we know that animals with horns tend to damage facilities, as well as some welfare issues that can come from getting stuck in fences or getting caught in milking stanchions and those types of things. We do know that it's painful. And so I do want to point out here that one of the things that we found in our benchmarking study surveys is that many producers do not view disbudding as painful. And generally they attribute that to the fact that when we finish disbudding, those animals immediately go over and nurse off a lamb bar or nurse off of the dam, whatever the case may be. But we actually know both from behavioral and biological markers of pain that this is a painful procedure. I think we can all appreciate that receiving a 3rd-degree burn on our skin is likely to be a painful procedure, and that this nursing behavior is actually an indication of stress and pain response. And so, we really see a disconnect there in the data that many of us, myself included, that grew up in a dairy goat operation, and have been disbudding all my kids all my life. There's some degree of desensitization that occurs there, and some degree of at least lack of appreciation of how painful this process is. So, but that doesn't mean that we don't do it. We just need to move forward with doing disbudding as humanely as possible. And doing so is the right thing to do. As we're stewards of raising these animals, it's the right thing to do right by them as best we can and mitigate the pain and mitigate the side effects that we can. Another component of this is that consumers are demanding it. So, increasingly, there are a number of websites that if you go out looking for them, talk about disbudding as, kind of a black mark on the dairy goat industry. I think we can all appreciate that videos of disbudding kids is probably not the best image of, that we want the consumers to understand how we are trying to do this best and how we are mitigating pain. But bad publicity is hard to overcome. And so much of this is being driven here, at least in the Midwest, through consumer demand to cheese processors and then cheese processors pushing down, best practices that need to be implemented on all the farms in order to mitigate this risk. So that I just provide as kind of a level set for, why are we talking about this? Why has this been an interest for our research team? And why have we been spending time and money to look at this? So moving on and thinking about, do we have options other than the traditional cautery disbudding? You saw from Natalie's email Natalie's presentation that the majority of folks are using iron cautery disbudding. And so what other options could we consider? Obviously, we could consider, in theory, selection for polled animals by mating polled animals. But in reality, at least right now, with the degree or the lack of degree of genomic testing that's performed in the dairy goat industry, this isn't really a feasible option because mating of polled animals is highly associated with intersex offspring. As some groups have been starting to evaluate that, not necessarily in goats, but looking at the genomics of that as a better understanding of determinants of sex and gender in other species. I think there is a space here where, as genomic testing gets expanded, we may be able to identify polled animals that lack that particular genomic marker for the intersex. It's going to be a minority of animals, but through genomic selection, we may be able to move forward with polled animals. Now, obviously, we always have this kind of funnel of how much genomic interest do we have there. We know from other species on the cow side that many times polled animals actually, there's an association, at least in cows, with decreased milk production. So it's not just as simple as, let's identify the polled buck that has this gene and then we're going to breed everything to it, because obviously if the genetics aren't there for productivity, that's going to limit our penetrance into the market. But down the road, that could be a possibility. But right now, as we know, genomic testing is pretty limited at least on the commercial scale in the dairy good industry. Cautery disbuddings are our mainstay, has been for a long time. There are some different approaches we can use to cautery disbudding, primarily different types of irons, both how they're heated, as well as the shape and morphology of the tip for disbudding. And we'll talk briefly about that, but we won't get into tip shape and all that stuff for brevity today. Also, there is, some evidence of cryo, and so we did evaluate cryo or freezing disbudding. Here recently, there's been interest in injectable clove oil disbudding because of several papers that kind of hit social media, and lots of folks were focusing on that. So we've evaluated that as well. And then topical disbudding paste. So these are kind of our viable options, or at least considerations de novo of what we could consider. And as we go through some of our data, you'll see here that not all of these are equally suited, and some of them have some fairly significant downsides. So, the mainstay has been the cautering disbudding, certainly the most commonly used. As I said, we have a couple of options of different types of disbudding irons. So the most commonly used here in the US, at least, is an electric-based one. You can also buy butane and propane ones. Those tend to be used a little bit more in cow dairies than in goat dairies, but some of our larger goat dairies are using those. And then I have the fired here. This would be the old-fashioned metal irons that you put in a hot coals and use. Very few people use those today, but you will still occasionally find them in some farms. I think the important thing to recognize here is that in these young kids, we have no sinus formation over the brain, and the skull there is very thin, so heat does pass through to the brain, and that can cause damage. So while this is our standby and our normal, and as you'll see at the end, to kind of give the punchline early, still what we see is the most viable and best option for disbudding of the different ones that we've talked about. We do have to be cautious how long we apply the iron for, and I'll give you some specific data that we've collected around that towards best practices for duration. And that really is driven by the size of the horn. So the smaller the size of the horn bud. So the earlier age that we're disbudding these animals, the shorter period of duration that we have to have the iron on the head, and therefore the lower the risk of thermal transfer of that heat through the skull. Iron, temperature of the iron is important, just as a, kind of for those that may not be as familiar. The butane and propane irons tend to run quite a bit hotter than the electric ones in terms of temperature, and they tend to continue to increase in their temperature for the longer period of time that they're on. And so it's not quite a steady temperature, but with time they actually continue to increase in heat. And so that on a practical scale may mean that you know, the first couple, if you're using a propane fired disbudding iron, and again, you're doing this at scale in a large operation with lots of kids, the first couple, the iron temperature is likely to be lower, and you may be able to leave that iron on the head for a longer period of time before you start to have issues, as opposed to after you've done 20 or 30 and now the iron has increased in temperature. The downside for the electric irons is they tend to lose heat during the disbudding process. So when they're hot and we apply them to the head, the temperature actually goes down as the heat's transferred to the head. And so this can result, if you use those irons too quickly back to back, it can result in decreased temperature that then results in a longer need, or the need to apply that iron for a longer period of time because of heat loss. And so when we're doing a large number of kids with electric irons and we're doing them consecutively fairly quickly, we actually recommend using two irons and alternating between them, so that one iron is reheating and holding its temperature while you're doing the kid with the other iron, and then alternating the next one. So I also mentioned cryo disbudding. Why would we look at cryo disbudding? Well, there's some evidence in cattle that freeze branding is less painful than hot branding. Now, obviously, these aren't cows, and so how they react isn't necessarily the same, but there are descriptions of several different approaches of cryo disbudding, and so we felt like it was important to at least consider that as a possibility. And so we looked at two different approaches. One using liquid nitrogen cooled metal iron, and so in this case we had a rod of metal. We cooled that with nitrogen and then applied that to the horn bud. And the other, we used a commercial cryo gun that floods the site with nitrogen. So this is more like a little bit more specialized equipment, like you might see at the dermatologist, a human dermatologist, if you go to have cryo on papillomas or some other skin cancer or something like that. So there's several studies that have evaluated this, both here based at Iowa State. We've published a couple of papers on that, as well as several studies in New Zealand. And what we see is, number one, these approaches don't tend to be reliable. We see a significant post-cryo disbudding incidence of scur formation. So right off the bat, regardless of the well-being implications, we see a much higher failure rate of cryo disbudding in terms of not having scur formation than we do in cautery disbudding. We also see increased vocalizations, and to the degree that vocalizations are one indicator of pain, that certainly is a concern. And as we look at a variety of both behavioral as well as biochemical and predominantly cortisol outcomes, we do not see any evidence that cryo is more humane in terms of pain induction than thermal cautery. So given its high complication rate or high risk of scur formation not being as reliable, combined with a lack of clear evidence that it's more humane from either biologic or behavioral or biochemical measures, we don't recommend cryo disbudding as a viable alternative at this time. As I mentioned, clove oil has gained some attention here in the last 5 or 6+ years. Social media has been somewhat promoting that in some areas. I want to be very clear here that at least in the US, and I know we have an international audience on the call here, but at least here in the US, FDA has been quite clear that use of clove oil is not a viable option in their view because of adulteration of the meat. But from a research perspective, we were interested in determining, is this really more humane? And so the animals that were treated with clove oil were removed from the food system and were euthanized and incinerated, so they didn't move into the food system. So I don't recommend this at all from a practical scale, but in terms of the pain research, what does it show us? We had some concern around the original research that had some design flaws. And largely the original research was more focused on viability in terms of its ability to disbud as opposed to the welfare implications or well-being implications. So what we have found, and again, these bridge studies done here at Iowa State as well as studies in New Zealand, we again see very inconsistent results with a considerable number of scurs. So there, as an approach, we have a higher rate of scur formation, failure of effective disbudding. We also have some concerns, at least based on the research that we did here at Iowa State, on the safety outcomes. So in our study, over half of the kids, and these kids were raised out several weeks to look for scur formation, and then we euthanized all of these kids that got clove oil, again, because FDA does not consider this considers those animals adulterated. So we had to euthanize them, and since we were euthanizing them, we opened up the calvarium on those animals, and over half of those kids had evidence of damage to the brain, many of those with meningitis and abscesses and septic meningitis at the site associated with defects in the skull at the site of clove oil induction. Now, we saw a much higher rate of that than, for instance, the studies out of New Zealand. We believe that that may be due to the fact that there's no kind of standardized clove oil. We measured eugenol in it, and that's what we were trying to use was, kind of a high quality chemical brand of eugenol, the active ingredient. But nonetheless, these aren't marketed as a specific quality controlled outcome. Most clove oil is sold in either homeopathic or other natural process medicine storefronts and has very little validation of actual eugenol content. So, why did our study show more of this evidence damage to the skull than some others? We suspected may be associated with the particular product that we were using. It may also have been a little bit associated with how we delivered the product, because we delivered that with a needle kind of perpendicular to the skin instead of horizontally injected under the skin. But in any case, we saw no appreciable benefits in terms of welfare concern compared to the thermal. So again, here we're left with a high rate of scur formation. Obviously in the US, FDA telling us that this isn't a viable option at all, and then no benefits on the welfare side based on behavioral and biochemical profiles, really suggested to us that this was not an option that we should be exploring significantly more. And then the last one I'll talk about here in terms of options is the caustic paste side. You saw in Natalie's presentation that actually the use of caustic paste on dairies is fairly low, 1% or so, I think, in what Natalie had. But we are seeing it growing in popularity on some of our goat dairies, our large goat dairies, particularly large goat dairies that also have significant cow dairy operations. And so they're moving some of their approaches more towards how they've adapted on the bovine side. When we talk to these folks, and you'll see here that ultimately my response here is going to be actually the welfare is better with thermal or cautery disbudding than caustic paste. But the significant driver of interest in using caustic paste, at least in our experience, is the fact that if there was an undercover video to be made by somebody that was trying to collect data nefariously against against the farm, the smoke and odor and acute vocalizations associated with thermal cautery are more provoking than some others. And so the movement to cautery or caustic paste seems to be driven predominantly by the fact that it is visually less concerning as opposed to physiologic or biological markers of pain. So we see that multiple studies have demonstrated that there actually is a greater pain component associated with caustic paste. There's higher cortisol levels. There's greater expression of pain-associated behaviors in caustic paste compared to thermal. And that's even when we have limited application. So in our study, we used caustic paste applied for 1 hour and then removed it. And so this wasn't leaving the caustic paste on long term. That helped mitigate some of those pain behaviors. But we also saw that 55% of them were not developed some degree of scurs. Now these were intact males, and so we were probably pushing that a little bit in terms of risk of scur prevent development, but again, it wasn't overly efficacious as an effective disbudding approach. So we do not recommend caustic paste as our primary means of disbudding, at least if our goal is to mitigate the pain and welfare implications associated with disbudding. So with that, what are the key points based on these options for disbudding? Well, we really believe the evidence suggests that the currently available studies and data that thermal cautery for disbudding remains the most welfare conscious approach to disbudding. We see that most of the other approaches have a significant failure rate in terms of scur formation. And given the fact that the other approaches fail to demonstrate measurable welfare benefits, or in some cases result in more pain, we still see cautery disbudding as being our primary best option or best practice here. So now comes the question of how long. And so to evaluate this, we did a pilot study. This is a fairly low number of animals because we used MRI as a measure of this. And so those MRIs cost us about $1,200 a kid. So, doing 6 or 7 kids is ends up, just under $10,000. And so, admittedly, this is a low sample size and provides some pilot data, but I think it's some of the only data that we have available. And this is published. I don't have the reference in here, but I can send the reference to those that are interested. But this was recently published. Again, as I talked about earlier, the skull is extremely thin here. So this is an MRI cross-section through the head of a kid. You can see the eyes here. And so up here where these horn buds are, they're shown in these calipers, you can see the thickness of the skull there. And so this thickness of the skull, when we measure, that's roughly the thickness of a business card. So I think we can all appreciate that, if we put a really hot iron on one side of a business card, there's a pretty good chance that you don't want your hand under the other side of that business card. And so, there definitely is heat transfer that occurs here. So in this study, we anesthetized these goats. So these were under general anesthesia, and we applied a cautery iron for 5 seconds, 10 seconds, 15 seconds, or 20 seconds. We counted that down using, a stopwatch, and then we woke those animals up from general anesthesia. We waited 4 days, and then we did MRI evaluation of those heads. And then in the majority of those kids, we then moved on to actual histopathology and dissection of the brain to observe and see if we saw changes in the brain at that time. So what did we find? Well, we found that even in application times as short as 5 seconds, in a small number, and again, this was only a total of, a fairly small pilot study. So I think we only had like 4 time points or 4 data sets for each of these time points, but in a small percentage of the 5-second application times, we could see some changes on the surface of the brain, both grossly as well as some mild edema on MRI. We did not see any overt neurologic evidence of disease. So none of these kids, even the kids that were burned for out to 20 seconds on a particular horn bud, none of those kids over the 4-day follow-up application period developed any sort of neurologic abnormalities from physical exams. So these presumably were not quite as bad as the ones we occasionally see with post-disbudding, kind of necrosis of the head. But as you can see in the pictures over here, and this is taken directly out of the published paper, you can pretty clearly see at 20 seconds and 15 seconds, we regularly could see some erythema and edema based on both MRI and histopathology, as well as grossly on these, longer duration time points, particularly the 15 and 20. It was very, very repeatable. So again, the caveat of a limited number of data points. So it's kind of hard, well, it's almost impossible to do any sort of statistics on this, but we do see some mild changes in animals as early as 5 seconds, but those did not result in any clinical disease. But we do see that 15 seconds or more consistently induced both visual, and by that I mean gross, changes, as well as pathologic damage to the brain based on MRI as well as histopathology. So our recommendation there is, as we apply these thermal cautery irons, we need to do everything in our power to minimize the amount of time on each of those horn buds. Again, we see that tying back to the age at disbudding, as well as the size of the horn bud. How long do we have to stay on there to effectively cauterize that horn bud? And so trying to keep that certainly under 10 seconds to the best of our ability per side is what we view right now as our best option. All right, so moving to the third question, how can we address pain? As we said, we know these animals are painful, and so it's our responsibility, both as producers but also as veterinarians, to try and address that. I'm not going to spend a lot of time talking about it here because at a scale size of many of our Midwest goat operations, it's extremely difficult to figure out how this would work. But the data is very clear that anesthesia, general anesthesia, is the best. And so in cases where that is feasible, that certainly is. And for instance, here at Iowa State, in our field services, if we're going out to do 2 or 3 pet goat disbuddings, then we have a portable anesthesia machine, and we very often will do that, again, in part because they're pets. But when we're looking at these larger operations, in writing this grant, I just did a little bit of math work, and if we have 6,000 does and so roughly 12,000 kids a year, and you even use some conservative estimates of, if we're going to do general anesthesia, 8 or 9 minutes per animal by the time we get them, mask them down with ISO or something else, do the disbudding and then monitor their recovery. Basically you would have to essentially have somebody running anesthesia full-time year-round to accomplish that amount of anesthetic disbuds. Now, it's easy to say, well, that's not feasible, that's impossible. I think it is important to recognize that some countries in the UK, they mandate that disbudding is done by veterinarians and has an anesthesia component to it. So, we have to be somewhat careful saying, well, that's absolutely impossible. But indeed, I think having that degree on the size operations that we're dealing with, that degree of anesthetic involvement, unless we're going to train producers to run ISO anesthesia on their own, irregardless of the cost component, this in the US system is near impossible, if not impossible, for a variety of reasons. So from our viewpoint, there's another option is the non-steroidal anti-inflammatory drugs, where we see consistent benefit in post-disbudding pain behaviors and pain measures, biochemical. And so meloxicam tends to be what we recommend due to, number one, it's the product that actually has the most publications supporting its use, and specifically in disbudding kids. Certainly there's some other non-steroidals out there, flunixin and others, but we don't have direct evidence-based use of those products and their impact on disbudding pain. Likely they do have the same sorts of benefits, but meloxicam, we have a number of studies all showing post-disbudding benefit. It is important for the producers to recognize that it does require veterinary prescription and oversight. It is an extra label drug use. And so, you know, it doesn't come without its challenges, but on a cost scale, it's quite easy to scale up. And, you know, we can do this for cents per kid if we use the generic oral meloxicam, and even the injectable small animal meloxicam prices come down to where, at least on smaller numbers of pet goats, I think it's a viable option. So what about lidocaine? And you know, I'm a huge fan of lidocaine blocks in dairy calves. Didn't grow up doing them on my dairy calves, but you know, now as a veterinarian, I use them routinely. However, I've not been convinced, both from my experience as a producer, as well as my experience at large scale on a commercial system, that lidocaine had all the same benefits in the goat side. And that's predominantly because we have more difficulty in applying the goats. So we have more sites of injection due to the innervation of the horn. So whereas we can get away with 2 sites on, you know, on a calf, we've got 4 sites minimum on goats. And from a practical sale standpoint, sometimes we end up doing ring blocks, and so potentially more than 4 sites. We have a smaller dose of lidocaine due to the smaller size of these animals, very young, you know, a week of age, and we're going to more sites, so less anesthetic per site. You know, on a calf, I flood the site with, you know, 6 mils per side. Well, on these baby goat heads, you know, even if we dilute the lidocaine down, we're a couple of mils divided between multiple sites. We know that it requires longer restraint due to those more injections. Now, so we set out to evaluate, using evidence base, you know, what's the benefit of lidocaine in this disbudding procedure? So what did we find? Well, number one, it takes considerable skill and practice to administer and get consistent results. And so, you know, many of those on the call are veterinarians, and so you're used to doing these lidocaine blocks, and you may have very good repeatability in your hand. We see that when we go out into a commercial operation and we have non-veterinarian producers trying to apply these same lidocaine blocks, we have a much lower success rate and potentially more complications. And actually the data is quite similar on the dairy calf side. So in some studies done in New Zealand and Australia, when we move from a veterinarian doing the local block to producers doing the local block, our success of a successful block decreases considerably. We've published this data, and so I can send folks to the sourcing for this statement, but both from a cortisol level as well as a behavioral level, we find that the procedure of doing the lidocaine block itself is as painful as the disbudding. So now, admittedly, we did not buffer the lidocaine here. We spent a lot of time talking about that buffering process and stuff. Ultimately, that came down to wanting to apply this at scale at a producer level, and potentially having a producer do that procedure, and that created some problems, most notably with perception of compounding and some of those issues from non-veterinarians. But and these, in this study, we did this on farm, and it was a non-veterinarian doing the blocks. We used a ring block of the horn. And so, you know, but the fact of the matter is the cortisol and the behavioral responses were almost identical to the block. Admittedly, we didn't see quite as much response and lower cortisols and a little bit less behavioral outcomes on the disbudding procedure itself, but the behavior and biochemical outcomes of the blocking procedure were equivalent to that of the disbudding without the block, really suggesting to us that the prolonged duration of restraint, the multiple handlings, at least again on a commercial scale, non-veterinarian using the product, non-buffered, again, because of compounding concerns and everything, it didn't make sense and really didn't show us the benefit that we see on the calf side. As I said, we also see that multiple studies have demonstrated in field application on the calf side, it's inconsistent in success. And so those failed attempts actually increase pain and well-being issues. And we don't have the option in these small goats of increasing our dose to make those blocks easier to be able to be a little bit further from those nerves and still have diffusion efficacy because of the fact that we're approaching toxic doses. So with all of this, what do we see as the prime outcomes? Well, our goal is to minimize pain, stress, and tissue damage while assuring effective disbudding. We know that the high rest periods for stress and pain, and we want to minimize those as much as possible. So we see those high risk periods as the period while the iron is on the head. We talked a little bit about that. We see that as the period that the kid is restrained. So even just that restraint drives up cortisols, drives up some behavioral responses. And we see in a third point there, the period that the kid is away from pen mates or the herd. We know these are very social animals. And so the longer that we have them separated from their pen mates, the higher or the more significant behavioral changes we see in these animals. So our goal is to know what these high risk periods are and try and minimize, mitigate, and address those to the extent we can. With regards to the iron, we have to keep the temperature of the iron in mind. If we're using butane or propane, those get hotter. We may need to decrease our duration of use. Again, even at 5 seconds with a thermal cautery, we were seeing some minor changes. 10 seconds is what we want to stay under. 15 and 20, we consistently see changes in the MRI and the pathology in those brains. And so those periods are based on cautery disbudding irons, and they may not apply. They may need to be shorter for butane or propane. We have to consider, again, electric irons lose heat. And so if we're using them repeatedly, we may need to alternate. Application time, the size of the horn bud is important. So our recommendations are disbudding kids as young as possible. As soon as the horn bud is visible, the longer we wait, the bigger the bud becomes, the longer the duration we have to use the iron. My preference would certainly be to see shorter than 14-day average that Natalie described on the dairy goat side. In many of our recommendations, we don't provide a specific age because we think that is impacted by several variable issues that I'll show you here in the next slide. But our recommendation is as soon as we can see a horn bud, then we're going to start moving towards getting those disbudded. And then pressure application. This is hard to measure. In our study, we used one person doing the disbudding and tried as best we could to use the same pressure for each of those. But as we increase pressure, that also increases heat transfer. In some cases, some of our iron tips actually have a sharpened edge that's doing the disbudding. And so that can actually dig into and impact the periosteum and result in some increased heat transfer there. So keeping that in mind is important. So disbudding when the horn is small, in most breeds, that's going to be 7 to 10 days of age. Some of these breeds grow horn much slower. Nigerian dwarfs tend to grow a much slower horn. There was some discussion on the AASRP listserv about that a couple weeks or months ago. So 7 to 10 days, you're probably not going to see a horn bud in those. So again, instead of setting a specific age, we recommend as soon as that horn bud is visible. But in most of our commercial Midwest operations that are predominantly Saanen and Alpine, somewhere in that 7 to 10 days of age, potentially even younger, 3 to 5 days of age for a buck is quite common because those males grow horn faster and they need to be disbudded at a younger age. And again, the duration of disbudding tends to be proportional to the size of the horn bud, so we want to disbud earlier. So our recommended best practice is meloxicam. Obviously, veterinarian has to be involved there. Oral tablet tends to be the generic oral tablet tends to be our go-to. We have, again, strong evidence from multiple countries, multiple studies showing a benefit. It's not going to impact your during disbudding pain control, but your post-disbudding management of pain, cortisol levels, how quickly those return to normal, as well as the behavioral changes, head shaking, using the back foot to scratch at the head. All of these different behaviors that we see consistently with disbudding are strongly influenced by non-steroidal meloxicam, even if it's administered at the time of disbudding. So ideally, we'd like to administer it a couple of hours before disbudding, but the data suggests that even if we give that at the time of disbudding, we still have benefit down the road. The oral tablet only costs us a couple of cents per kid. It can be drenched, or many of our farms now are giving this as a pill, just like you'd pill a dog or a cat, just shoving it in the back of the mouth with their finger quite effectively. And so it's quick to administer, low cost, has demonstrable benefit across multiple studies, across multiple countries. The injectable for some folks is a little bit easier. Both are extra label, both require veterinary involvement, but the cost is higher on the injectable. But it does save the pilling or drenching issue. So then finally, how do we monitor success? Well, we really use these scurs and disbudding failures as a measure of our success. So we recommend that farms monitor their scur formation. And if we see that we're getting a lot of scurs, that tells us that we need to likely do something different in our disbudding practices. And in many cases, we're waiting until those horn buds are too large or the animals are too old. Obviously, we see more scurs in intact males with testosterone. But again, if we hit those kids or those bucks earlier, when that horn bud is smaller, we tend to have a higher success rate. We obviously also want to monitor for other complications, neurologic disease in kids. In some cases, that's heat damage or thermal cautery or thermal damage to the brain. And in other cases, it could be a septic meningitis from infection penetrating the brain. And then finally, probably the most common issue that we see is a locally infected disbudding site. So under that kind of scab that forms under the where we've disbudded, local small abscesses. If those aren't opened up, they can penetrate down in through the calvarium. But in most cases, we can manage those with topical approaches. So if we're going to see neurologic disease, the most common thing we see is an inability to stand and walk normally. We may see seizures, stumbling to one side, a head tilt to one side, or sudden death. This picture here is actually looking a little bit blurry, but you can see this is actually a pretty nasty septic meningitis, quite a bit of purulent material in this brain. This happens to be a picture of one of those clove oil disbuds that we talked about earlier. But definitely don't want to see those outcomes. So as we finish up here, some key takeaways. Disbudding is a painful procedure. Thermal cautery is, in our mind, the most welfare conscious approach. The best practices include having the right equipment that's functioning well, minimizing the time away from herd mates, disbudding while the bud is small, minimizing the time of the iron on the head, using meloxicam or other mechanism to mitigate pain, and then monitoring our success. And with that in mind, I mentioned this is very much a team effort. Dr. Jan Shears on the call today with us as well. He's a colleague here at Iowa State and a co-PI on this grant. Dr. Melissa Hempstead did our postdoc with her. Many of you have met her. She's back in New Zealand now. She was originally from New Zealand. Her PhD was in anesthesia-based disbudding approaches in New Zealand, very good industry. She came over and spent 2 years with us working on this project and now is back in New Zealand. Dr. Kelly Still-Brooks, previously at Iowa State, now at Colorado State. And Dr. Suzanne Millman helped lead some of those comparisons of the cryo approaches and the clove oil work, very instrumental there. Dr. Vari Sutherland is at New Zealand Ag Research, has been very active in disbudding research over there and collaborated through Melissa on several of these projects, as well as helping with a little bit of funding. Taylor Lindquist, who's actually on the call today, did her master's with us in dairy goat well-being, and now is just finished her first year of vet school at UC Davis. And so she was definitely involved in all these research projects and actually has developed some training materials for producers, a short video on these approaches that we can use to train producers. Leslie Shear was involved, a number of our students and researchers. Again, we gratefully acknowledge our research support from both USDA as well as Saputo, and then the involvement of the extension team here, Jen and Fred and Larry and all the rest of them. So with that, I will stop sharing my slides and answer any questions.
Thanks, Dr. Plummer. It looks like we have quite a few questions that came in the chat box here as you were giving your presentation. So we'll take those, but just want a reminder that I did put the link to an evaluation into the chat box. So before you log off today, just remember to click on that link and give us some feedback on our webinar here today before you leave. So I appreciate that. I'm just going to go down the list of questions, Dr. Plummer, if that's okay with you, and we'll kind of see where we go here. So,
yep.
How old were the kids used in the disbudding MRI study?
Yep. So those kids were picked up at a couple of days of age. Obviously we were sourcing them from a dairy, so it was just as quick as we could get them and then get them back. So those were no older. I think our oldest one of those by the time we disbudded was like 9 days. So they were on the young side.
And then there was a comment, so the failure to buffer and the ring block explain a lot. What size needle did you use?
Yep, Joe. So yeah, I figured you'd ask a question about that. We did, again, we did select not to buffer here because at least on the commercial scale, we think that creates some problems for producers to be doing that. We used, I'm going to have to look back and maybe Taylor remembers, I think it was a 22 needle, 22 1-inch needle. We used a triangular shaped ring block. So we actually did 6 injections in a triangular shape around each of the horn buds. So I think a very different application, than a veterinarian doing that in a clinic. But I will say that the farm that we did this on, and this was a commercial farm, but they said, you're never doing that on our farm again. That was the worst thing we've ever seen in our lives. So for those that may not be aware, we do know that lidocaine is acidic. It does cause pain. If you've ever had a lidocaine block yourself, that it does burn like the dickens, and so buffering it allows us to mitigate some of that pain. The buffering, though, again, has some difficulties, at least at the commercial scale, because we're modifying the drug and having producers do that out on farm. It also kind of destabilizes it. So how long can that last? And we do know from other studies that, just the needles themselves have some degree of impact. So admittedly, if we buffered, we may not have seen quite the same degree of pain that we did. But we do know that there's going to be pain associated with those needle injections and restraint, particularly if we're doing multiple injection sites. So do you use the same times for smaller breed goats and boar goats? So we haven't tested that. All of the goats that we did MRIs on were Alpine and Sonans. Majority of them were actually Sonans. In theory, the Sonans probably a little bit bigger, may have a thicker skull. A Nigerian dwarf, may not have as thick a skull. No information on boars, and obviously on Nigerians, if you're waiting till they're older, because you don't see a horn bud until they're 14 or 21 days, the thickness of the skull. So I really can't comment on how long in those younger breeds or the smaller breeds, as we don't have any MRI data on them. What about using an alpha-2 and or butorphanol? So I think those, again, Joe, are certainly options in the veterinarian's hands, but not options in a commercial scale out on farm. And so, butorphanol being a controlled drug, I do, as an internist, I do have some concerns about cardiac impacts of alpha-2s in these really young animals, and dosing those appropriately. I think if you use something like a small animal alpha-2, you're probably okay. But vets trying to use 100 milligram xylazine typically runs into some pretty significant issues. But ultimately for us is, how can we apply this on a farm with 6,000 goat kids, and butorphanol is not a viable option. In the event scurs fall off, get kicked off, as usual, things like Vetricin spray or something else. When the scur breaks, does that actually get closer to the brain? So scurs, by definition, are not attached to the skull. They're in the skin. So generally, we address those as kind of a topical wound type of approach, and some cleaning, making sure they don't get maggots and fly strike and some of these other options or other possibilities. And so fly control, and then some sort of topical disinfectant or management. Generally, those don't lead, unless they get a severe local reaction associated with fly strike or something like that, likely not to penetrate into the brain. Dr. Snyder commented here, again, using butane portazole takes 2 to 3 seconds. So higher temperature, shorter duration. And so that would be our recommendation if you're using those irons, to use a shorter duration. Dose on meloxicams. Happy to talk through that with you. We do have a handout that we use on this. It's a little bit higher than the typical loading dose. So most cases we see are a loading dose of meloxicam for goats of 2 mg per kg, followed by follow-up dosing of 1 mg per kg intermittently. In these cases, we're using a single-time application, so we're not redosing. So we're going with a one-time loading dose. For convenience, we find it works pretty well to actually use a 15 milligram tablet in a full size, or a Alpine Sonnen kid of this age. That actually works out to about 2.2 or 2.3 milligrams per kilogram for a lot of those kids. But again, because it's a single application, we find that we have not observed any downsides to that dosing, and using a single 15 milligram tab is easier than trying to break apart and use 2/3 or 3/4 of a tablet. So I wouldn't want to use that dose if I was repeating that dosing, but with a single application. Looks like Charles is asking about sharing presentation or sending a link. I think Jen got that covered. She'll send the link to everybody. So the videos will, the educational videos that Taylor's working on, we're working on getting those available. Those were funded by Saputo, and so we're getting those rolled out first to Saputo members, but then those will be widely available. They will be sign-in, so down the road here, we'll get you information about how to sign in. We have those behind a firewall, because obviously there's actually videos on euthanasia and foot trimming and some others, but particularly disbudding and euthanasia ones aren't something you want to pop up on YouTube when somebody searches goat. So those are sign in. Try and stay under 10 seconds per horn. Is it advisable to do 5 seconds, wait them 5 more, and then finish the job, or 10 all at once? So, basically, do you try and apply some and then wait and then apply longer, or is it better to do it all in one foul swoop? I don't know that we have strong data on the MRI study, because in the MRI study, we did those as a single application. What we do tell people is that it's the cumulative time. So when I say 10 seconds, that's 10 seconds, regardless of whether that's, 3 applications of 3 1/3 seconds or 10 seconds continuous. So I generally recommend doing it all at once and trying to be as short as possible. So I'd rather not be 10 seconds. I think we actually see, in some cases, when we have animals anesthetized and you have an inexperienced disbudder, that's where we sometimes get into issues, because we have a prolonged application time because the animal's not reacting, and 10 seconds doesn't seem that long. And so sometimes them screaming gets you done quicker. Now, experienced experienced disbudders, you know, have a feel for that, and that's very consistent. But actually, in veterinarians that don't disbud routinely and they anesthetize, that's some of the cases I see some issues in, because they're just so worried about, is it completely copper all the way around, and they keep touching it up, and we're too much of a perfectionist. Yeah, and so Carolyn's question is pretty similar. I recommend getting on one side and you know, getting it done, and then going to the other side. Ice packs to buds after disbudding. You know, I think it's going to cool the area down more. We don't have any evidence to say, you know, I don't have any direct evidence to say that we saw less MRI changes when we applied a ice pack afterwards. Well, we didn't apply an ice pack in this study, but we didn't test that. So, but to the extent that ice decreases local inflammation, and, you know, we use ice in pain in humans, I think on a small scale, ice packs are probably reasonable. On a commercial scale, again, when we're doing hundreds of kids a day, you'd have to have a big freezer and a lot of ice packs, and a lot of people to hold ice packs on their head, or a lot of gauze or something. So probably not feasible on the large scale, but I don't think it hurts, certainly. So looks like that got through them, Jen. I know we're a little bit over time here, so.
Nope, that's great. You made it through it. Thank you very much for all the information. I think it was really great to bring the research perspective as well as the practical application of how to disbud. So that's great. Again, I will record this webinar, and it will be archived. I'm going to send that out. It will be in probably in your email tomorrow to all the people that registered for the webinar. So look for that afterwards. Again, I'm going to post the evaluation here. Before you leave, just click on that and take our quick evaluation. So again, I want to thank Natalie and Dr. Paul Plummer for their information here today, and look forward to presenting another Dairy Goat webinar in the future. So thank you.